Hello everyone. Next we'll be discussing about anticonvulsants. Okay, we are currently doing the central nervous system pharmacology. Okay, so these are the drugs that are used in seizure control. Okay, so what is a seizure? Seizure results from episodic electrical discharges in the cerebral neurons. Okay, basically it is cerebral dysarrhythmia. Okay, when there is uncontrolled release of electrical activity in the brain or uncontrolled occurrence of electrical activity in the brain, it will cause seizures. Okay, so uh, to control these seizures, our goal should be the restoration of these uncontrolled electrical activities. Okay, so how do we control these electrical activities? So what are the pharmacological strategies in order to control these seizures? One is you can either decrease the action potential generation or you can decrease the conduction of action potential. Okay, so these are the two pharmacological strategies. Okay, next we'll see about how these drugs work. Okay, how these anticonvulsants they work. Okay, so what are the mechanisms of actions of these various anticonvulsant drugs? Okay, mechanism of action. First we'll deal with this carbamazepine and phenytoin. Okay, what these two drugs do is that they excuse me, they bind with the voltage gated sodium channels, okay, in the neuron, and they keep the sodium channels in inactivated state. Okay, so what are the three states of the sodium channels? That are resting state, activated state, and inactivated state. Okay, remember that only in the activated state the entry of sodium ion is permitted. Okay, so these drugs they will keep the sodium channels in inactivated state. Okay, that means that no any further sodium entry can occur inside the neuron. Okay, since no any further sodium is entering, that will cause inhibition of repeated generation of action potential. Okay, thus preventing or reducing the spread of seizures. So this effect is basically a membrane stabilizing effect or neuron stabilizing effect. So if the neuron is no longer firing, then means after the stabilization of its membrane, then what happens that no any further repetitive generation of action potential occurs. Okay, so next we'll discuss about what is the mechanism of action of the drugs benzodiazepines and barbiturates, mainly phenobarbital, as anti-epileptic drug. Okay, so these two drugs they increase the GABA activity. Remember that GABA is a major inhibitory neurotransmitter. Okay, inhibitory. So basically what it is doing is that it is inhibiting the transmission, inhibiting the generation of action potential. Okay, so how? Okay, this causes opening of chloride channels. Okay, so more negatively charged chloride ion will move inside the neuron. Okay, thus it will decrease the resting membrane potential and make the cell hyperpolarized. Okay, thus decreasing the capacity of neuron to get easily excited or decreasing the neuronal excitability. Okay, so this is the mechanism of action of benzodiazepines and barbiturates. Next we'll see about bulboric acid. Okay, so it is a broad spectrum anti-epileptic, meaning that it has multiple mechanisms of actions. Okay, it has similar action to that of phenytoin, ethosuximide, okay, and even like that of benzodiazepines and barbiturates. Let's see how. Okay, so it delays the recovery of sodium channel from their inactivated stage. Okay, as we have discussed just earlier, just few minutes ago, it keeps the sodium channel in inactivated stage. Okay, so no any further recurrent depolarization is occurring or repetitive action potential is being generated. Okay, next important mechanism of action is that it blocks the T-type calcium channel. Okay, remember the T-type. Okay, calcium channels in thalamic neurons. Okay, mainly presynaptic area. Okay, so the thalamus is a sensory motor relay area. Okay, so basically these valproic acid and ethosuximide, they block this T-type calcium channel in thalamus. Okay, so these drugs, this drug ethosuximide and valproic acid, they are used in the treatment of absent seizure. Okay, so mainly this ethosuximide drug. Okay, so what happens in absent seizure is that your brain becomes unresponsive to any sensory input. Okay, and in absent seizure, since most of the other anti-epileptic drugs are CNS depressant, it will exacerbate, or they will exacerbate the absent seizure. Okay, so these two drugs, ethosuximide and valproic acid, they can be used in the management of absent seizure. So the third mechanism of action is that it increases the GABA activity. Again, GABA is a inhibitory neurotransmitter. Okay, it will increase the synthesis of GABA, and it will decrease the degradation of GABA by acting on various enzymes. Okay, it will increase the synthesis of GABA by stimulating the enzyme glutamic acid decarboxylase. Okay, or GAD. Okay, and it will decrease the degradation of GABA by inhibiting the enzyme GABA transaminase, or GABA T, GABA transaminase. Okay, so this is the mechanism of action of valproic acid and ethosuximide. Okay, next we'll discuss about some seizure types and what are the drugs that are particularly used in particular seizure types. Okay, so the first one is focal seizure. It was previously known as, let me use a different color. So these focal seizure, it was previously called partial seizure. Okay, and it had two types: simple partial seizure and complex partial seizure. But now the nomenclature has changed slightly, and it has become focal seizure uh, with loss of consciousness and without loss of consciousness, or with awareness or without awareness. Okay, so what are the drugs that are used in partial seizures? Okay, remember, partial seizure is a type of seizure in which the electrical activity starts on one part or one side of the brain. Okay, that is partial seizure. So the drugs that are used in partial seizure are valproic acid, phenytoin, carbamazepine, and lamotrigine. Okay, so these four drugs. Okay, the next is generalized seizure. Okay, mainly generalized tonic-clonic type. Okay, the next is generalized tonic-clonic seizure. Okay, generalized means that its onset occurs within the whole of the brain. Okay, so tonic-clonic means that your body goes into a stage of tonic, that is increased tone, and it will cause spasm or rigidity of your whole body. And clonic stage means alternating moments. Okay, like a clonus. So your body will alternate between tonic and clonic stage. Okay, so what are the drugs? Okay, these are all drugs in this first category. Okay, valproic acid, phenytoin, carbamazepine, and lamotrigine. So the next is in absent seizure. Okay, we already talked about absent seizure and the drugs that are used in absent seizure. Okay, remember the absent seizure, there it is also a type of generalized seizure. Okay, uh, if you want me to describe the classification or types of seizure, I'll do that in a separate video. Okay, so the drugs are ethosuximide and valproic acid. They act by blocking the T type of calcium channels. Okay, mainly in the thalamic neurons. So the last seizure type is status epilepticus, means this epileptiform activity or the seizure activity is going on for prolonged time. Okay, means the person can have seizure now, the seizure activity will subside for some time, and then again seizure will occur, but the person will not recover consciousness in between, or the seizure activity is continuously occurring for some period of time. Okay, so the drugs used are these lorazepam, diazepam, phenytoin, and midazolam is also used to control the acute seizure activity. Okay, next we'll discuss about individual drugs. Okay, mainly the drugs that I'm going to discuss here is phenytoin, carbamazepine, bulboric acid, ethosuximide, and few little things about other drugs. Okay, now let's see about phenytoin. So now we move on to the drugs. Okay, let's start with phenytoin. Okay, we've already discussed about the mechanism of action, that it blocks the sodium channels in the neurons and keeps them in their inactivated state. Okay, so preventing further seizure propagation. Okay, so the uses are any seizure states except absent seizure. Okay, so these are the three important points. Now let's see some of the important points in the pharmacokinetics of phenytoin. Okay, so the drug phenytoin, it follows zero order kinetic of elimination, meaning that a constant amount of drug is eliminated per unit time. Okay, meaning a fraction of drug removed from body decreases with increasing drug. Okay, okay, excuse me. Let's suppose 10% of phenytoin is excreted from the body in 1 hour. Okay, let's suppose. Okay, so 10% of 10 mg is 1 mg. Okay, so 1 mg is excreted in in 1 hour. Okay, if we keep on increasing the dose, okay, that's 100 mg, then only 10 mg is excreted. If we increase the dose to 1000 mg, then only 100 mg is excreted, means the remaining 900 mg of the drug is still inside your body. Okay, so this is dose dependent elimination, meaning that as you keep on increasing the dose of phenytoin, the likelihood of development of toxicity is very high. Okay, so be careful if you are giving phenytoin in high dose. Okay. Generally, why this happens is that the metabolizing enzyme of phenytoin, it gets saturated, so it cannot further process the high dose of drug that is present in the body. Okay, look at this small graph. Okay, here I am showing the concentration against dose of a drug. Okay, so as you let's talk. Sorry, I've been experiencing some cold lately. Okay, so okay, so as we keep on increasing the dose, the concentration of the drug in the body, it goes on increasing. Okay, why? Because only a fixed amount of drug is being eliminated in the body, from the body. Okay, this is also called non-linear kinetics because it does not follow path like this. Okay, it follows a path like that. Okay, let me change the color. Path like that. Okay, let's move on to the next point. Okay, second is cytochrome P450 induction. Okay, induction of these cytochrome P450s will cause increase in metabolism of some other drugs like oral contraceptive pills, steroids, thus decreasing their efficacy. So if a lady is on phenytoin and if she is also taking these oral contraceptive pills, then she might get pregnant despite being on contraceptive methods like oral contraceptive pill. Okay, the next is variable absorption. Okay, the absorption of phenytoin is variable. Okay, we have already discussed about non-linear kinetics. Next we'll see about what are the side effects of phenytoin. Okay, I made a long list here and I've included a mnemonic. The mnemonic is H. Okay, so let me write here a big H. So if you remember few of these H, then it will be very easy. So the first one and the most important one and peculiar to phenytoin is hypertrophy and hyperplasia of gum. So gingival hypertrophy or hyperplasia. So what you do is you keep a good dental hygiene, proper dental hygiene, then the chances of these happening will be decreased. Okay, so the next is hypersensitivity reaction. Now, so it is the second nest. The third one is hirsutism, means increase in body hair. Body hair, hirsutism. Remember this, hirsutism. Okay, the next one is hyperglycemia. How hyperglycemia occurs? It is due to decrease in insulin release due to effect of phenytoin. Okay, so the next one is hepatic necrosis. It is one of the very deadly side effect of this phenytoin drug. Okay, but it is a rare side effect. So the next H is hydatone. Sorry, not neurosis. Okay, I have written it wrong. Hydatone syndrome in fetus. Okay, let me erase that. Okay, hydatone syndrome in fetus or fetal hydatone syndrome. It is among the teratogenic effects of this drug. Okay, a teratogenic effect of phenytoin. So it consists of cleft lip, cleft palate, and digital abnormalities. So obviously phenytoin will be contraindicated in a pregnant lady. So these other three side effects: megaloblastic anemia, aplastic anemia, osteomalacia. These are common in most of the anti-epileptic drugs. Okay, and teratogenicity also. So megaloblastic anemia, it is due to decrease in folate levels in the body. Okay, and aplastic anemia, it is generally due to hypersensitivity reaction. Okay, regarding about osteomalacia, it is due to decrease in vitamin D levels. Decrease vitamin D levels due to decreased vitamin D absorption. What happens is that phenytoin uses the enzyme hydroxylases, okay, for its own metabolism, and there is less amount of hydroxylases left for vitamin D activation. Okay, this will cause hypocalcemia. Okay, thus resulting in various disorders related to calcium. But remember, hypocalcemia will stimulate the parathyroid gland and will cause secondary hyperparathyroidism, and that will in turn cause hypercalcemia. Okay, so remember that phenytoin can cause calcium disorders. Okay, so calcium disorders, and due to secondary hyperparathyroidism, phosphate disorders also. Okay, you need to remember that this aplastic anemia, it is a very dangerous side effect. So you need to monitor the WBC count of patient if you are putting a patient on the drug phenytoin. Okay, so next we'll discuss about carbamazepine drug. Okay, now we'll discuss about carbamazepine. We have already discussed about the mechanism of action. It is similar to that of phenytoin, that is keeping the sodium channels in their inactivated state. Okay, so what are its uses? Okay, it is used in seizure disorder, mainly other types of seizure disorder except this absent seizure. Okay, it is also used in trigeminal neuralgia. Okay, let me change the color. Trigeminal neuralgia. Okay. What happens is that since these drugs they have CNS depressing effect, so they may decrease the perception of pain. Okay, so that's why maybe that is the reason why they are used in trigeminal neuralgia, that is neuropathic pain. Other drugs that are used in neuropathic pain are amitriptyline. Okay, so the next use is bipolar disorder, mainly the manic phase of bipolar disorder. Okay, so these are the uses. Moving on to the pharmacokinetics of these drugs. Okay, similar to that of phenytoin, it induces the cytochrome P50 enzymes. Okay, but one interesting thing is that it also induces its own metabolism due to this cytochrome P450 activity. What happens is that phenytoin will induce this enzyme and in turn increasing the rate of metabolism of not phenytoin, carbamazepine, in turn increasing the rate of metabolism of carbamazepine itself, thus decreasing the duration of action. Okay, so next the side effects. Okay, the side effects are CNS depression. Okay, these side effects, they are common to most of the antiepileptics. Okay, CNS depression, osteomalacia, megaloblastic anemia, aplastic anemia, okay, and teratogenicity. These are common. And there are some special side effects of carbamazepine as well. Like Phenytoin had hyperplasia and hypertrophy of gum and hirsutism. This carbamazepine, it has Steven-Johnson syndrome or exfoliative dermatitis. Remember that it is an dermatological emergency. Okay, and the next one is increased secretion of antidiuretic hormone. Antidiuretic hormone. It can lead to retention of more amount of water, okay, thus causing dilutional hyponatremia and even edema, including cerebral edema, causing rise in the intraocular pressure. Okay, and the last one is teratogenicity. Among teratogenic effects, these are cleft lip, cleft palate, and spina bifida. Okay, spina bifida, it can be attributed to this decreasing folate activity. Okay, remember that these ADS secretion, these are increase in ADS secretion, these are also seen with antidepressants and antipsychotics. Okay, next we'll discuss about the valporic acid. Let's now see the drug valporic acid. Okay, we have already discussed the mechanism of action. Basically, it blocks or keeps the sodium channel in their inactivated state. It also causes inhibition of GABA transaminase. That is, it increases the level of GABA. And third one is blockade of D type of calcium channels, mainly in thalamic neurons. Okay, so what are the uses? Its uses are seizure activity or seizure state, including absent seizure. Okay, remember that Phenytoin and carbamazepine, they were only used in seizure state, but excluding absent seizure. This valporic acid can also be used in absent seizure. Okay, so the next one is bipolar disorder, mainly mania stage, similar to that of carbamazepine. And third one is, importantly, migraine prophylaxis. Okay, so what are the pharmacological pharmacokinetic points? Okay, the main point is that it inhibits cytochrome P450 enzyme. Okay, remember the other drugs, Phenytoin, carbamazepine, barbiturates, they induce the enzyme cytochrome P450. Okay, whereas valporic acid, being unique as it is, okay, it will inhibit the cytochrome 450 system. Okay, next we'll see about the side effects of valporic acid. So there is an easy mnemonic. Remember, just remember valporate. Okay, so valporate. So V is for vomiting. Vomiting. Okay, A is for anorexia. These are common side effects. Okay, it can sometimes also cause ataxia. Okay, so L is for liver. It may cause fulminant. It is very rapidly occurring hepatitis. Okay, L. P is for pancreatitis. It is one of the important drug causing pancreatitis. Okay, remember that there are few other drugs that can cause drug-induced pancreatitis. Okay, one is diadenosine, zalcitabine. Okay, this can cause severe pancreatic toxicity. Okay, and among the anti-diabetic drugs, the gliptins, sitagliptin, saxagliptins, they can also cause pancreatitis. Okay, O is for orofacial abnormalities. Orofacial abnormalities. Okay, that is teratogenic effect. But remember that the major teratogenic effect of this valporic acid is spina bifida. Okay, spina bifida. Okay, R is for rashes. R is for rashes. A is for alopecia, that is decrease in the number of hair or increased hair fall. Remember, phenytoin causes hirsutism, and bulboric acid causes alopecia. T is for teratogenicity, or you can also say thrombocytopenia. Thrombocytopenia. Okay, so it is important to observe the platelet levels. So the last one, E, is elevated LFTs. Okay, that is meaning that permanent hepatitis. Okay, so this is the mnemonic of to remember the side effects of this drug. Okay, bulboric acid. So an easy way of remembering the teratogenic effect is okay. So phenytoin, bulboric acid, and carbamazepine. It causes cleft lip and palate. Bulboric acid mainly causes spina bifida. And lastly, carbamazepine, it causes both. Okay, it causes both of these effects. Okay, so the other drugs that are commonly used nowadays. Okay, okay. Before that, let me tell something about ethosuximide. Okay, ethosuximide. Okay, so it acts by blocking the T type of calcium channel in thalamic neurons. So T type calcium channels, and it is used in absence seizures. Okay, absence seizures, and its common side effects are nausea, vomiting, anorexia. Okay, then lastly we'll discuss about the other or newer anticonvulsants. Okay, so lamotrigine, it blocks the sodium channels and glutamate receptors. Okay, it can be used in various type of seizures, and the common side effect the important, not common but important side effect is Steven-Johnson syndrome. One of the new anti-epileptic that is being very commonly used nowadays is levetiracetam. Okay, levetiracetam. Its mechanism of action is quite unclear till now. Okay, but it is being very commonly used, mainly I think due to its less interaction with other drugs and lesser side effects. Okay, so the other anti-epileptic drugs, they are topiramide, felbamate, gabapentin. Okay, so lastly, let's discuss some general features about anti-epileptic drugs. Okay, general features. So the general features are that since these anticonvulsant, they are causing CNS depressive effect. So if you give or mix anticonvulsant drug with other CNS depressant, then there will be additive effect. Okay, so more CNS depression. And remember, never ever suddenly stop the drug. Okay, no sudden stoppage. Okay, it can result in seizure, even dangerous status epilepticus. Okay, so I've already told the other point that due to the induction of the cytochrome P450, it will increase the metabolism of oral contraceptive pills, thus decreasing their efficacy. Okay, and remember the common side effects, they are teratogenicity, megaloblastic anemia, aplastic anemia, okay, osteomalacia. And remember the special side effects about each drug, like phenytoin, it causes hirsutism and hypertrophy and hyperplasia of gingiva. Okay, carbamazepine, it causes Steven-Johnson syndrome, and increase in ADH secretion. Bulboric acid, it causes pancreatitis. Okay, it causes pancreatitis and thrombocytopenia and liver damage. Okay, remember these things about anti-epileptic drugs. I think this concludes the anti-epileptic drug or anticonvulsant drugs. Okay, so until next time, bye bye, namaste.